Hello, everyone. My name is Anita Iyer, and I run Ekansh Trust in Pune. Demystifying Disabilities is a video series on disabilities. We talk about prevention, detection, and early intervention across age groups, not just in children, but also in adults. Today, we have with us an experienced geriatric specialist, Dr. N. Prem. Thank you so much, Doctor, for joining us. And we will
My
be
pleasure.
talking about disabilities among people who are our senior citizens. Dr. Prem,
Yeah. Hi.
hi. So the first question I would like to ask you, if I may begin, is does what are the most common disabilities that you see in geriatric patients these days?
Yeah. First of all, thanks a lot for inviting me on this very, I think, important uh, platform that is demystifying disabilities. I think age is usually a number, but there are certain disabilities which obviously affect older adults as they grow older, and that can be very challenging. So, usually, the common ones which really put them down include, of course, foot problems, which are, to be very frank, very much neglected. Then, arthritis, uh, cognitive impairment, which is, of course, memory loss, heart problems, to a great extent, vision, then hearing impairment, I think, is very important. Then having respiratory diseases such as COPD, heart failure, and cardiovascular disease, that is, and of course, coronary heart disease and CVA, which is a stroke. Now, one of the most common causes of course, disabilities is maybe having falls and then a hip fracture. So, the biggest problem in an older adult is what happens is a small insult can actually end up being a big one. So that is what we call as a domino effect, in which a small insult in an older adult with maybe one of these disabilities just worsens them so badly that their quality of life, which is often the word used by a geriatrician or an elder care specialist, is the one which is affected. And as they say, being disabled uh, becomes very difficult to handle, especially because disability and independence are very much going hand in hand.
The dignity of a person as gets impacted, I think, by disease and disability, and the fact that they start needing care as they get older. People who have been independent all their lives. Um, so my next question is: does the incidence of risk for certain disabilities increase with age? That would, of course, refer to diseases that lead to the onset of disabilities as well. How would you say that this risk can be reduced?
Yeah, I mean, in my time, of course, I practice in Jaslok Hospital in Mumbai as the consultant in geriatric medicine there. So, what I would say is age is, of course, a very big factor. Now, why? Because we are dealing with an aging body. So, if you have to see, before I go into what to prevent it, I would just want to explain it a bit. As we age, there are a lot of things like change in the body composition. So, the muscle bulk that reduces, body fat tends to increase. Now, the bone mass is there, strength is there, which decreases. So, the risk of fracture that increases. Then the lung capacity that itself sort of decreases. Then the blood pressure with posture change, for example standing, sitting, ability to control that also decreases. The kidney function, the thirst mechanism, they decrease a lot. Then nervous system changes happen, and of course the elasticity of the islands, and of course hearing impairment. So all these things are setting in as age grows. And the diseases which really put older adults down, which I mentioned, is one of them, which I didn't mention, is diabetes. I think diabetes, Alzheimer's, urinary problems, depression, which can be put under the table very, very easily because it is not talked about much in any age group, let alone old age. And when that happens, along with maybe visual loss, hearing loss, these are the things which would really sort of put an older adult down. Now, how do you lower the risk? I think that is very, very important. One of the most important things is to actually understand what your ability stands and to what extent you need help. Because a lot of independent older adults do not approach help just thinking, I didn't need it till now, so I do not need it anymore. Uh, uh, an assistive device, for example, maybe a walker or a stick, should never be considered to be a burden by the older adult. It is actually helping them to improve their independence rather than them dependent. Similarly, a hearing aid is always considered as something which is I don't want to wear, or people will say this and that. But if you counter view it, you are actually not going to hear anything at all. So I think that is something which would be bad. Same is with spectacles. Another inertia which older adults have is using dentures. I think
Right.
eating is one of the most important things to nutrition, and dental hygiene, dental health is very important to actually maintain that ability to eat. So whatever diet I might give you, if you don't have teeth, you might not be able to eat it. So don't have that that you can say an inertia or that thing in your negative mindset. No dentures, oh, I'll have to go, I'll have to make, it's all a painful process, it's expensive. And another thing is, older adults make the dentures, they tend to use it, and even if it is paining or it is actually causing them ulcerations, they tend to tolerate it, saying that, oh, we have to go again, another money might be involved. So don't do that. Try to be comfortable, because these are the things which are going to help you. But apart from that, how do you lower the risk is basically try to treat the unstable medical conditions. For example, I said if you go into a heart failure, we try to treat that. Then drug treatment. I think drugs, which is especially we deal with something known as polypharmacy in older adults, which can be really, really problematic. So that is something, reduction of drugs, which drugs are needed, what are the side effects, that also helps in actually decreasing disability. Then early mobilization, try to make sure that the immobile elderly is moving much more earlier as compared to maybe just them not trying to move. So what happens, for example, even after a surgery, if it's a knee replacement, if physiotherapy is not started immediately, there is no use of replacing the knees. So try to encourage older adults to actually move. Along with that, of course, nutritional support is very, very important, because the nutritional support goes hand in hand with trying to make them exercise and trying to improve their general health. And yes, proteins to a great extent are needed for muscle building, carbohydrates will be needed for energy. So, a balanced diet, which is very important, and a comprehensive rehabilitation. I think that is very, very important in identifying what the disability is, trying to correct the correctables, and at the same time give a comprehensive plan of care so that the overall rehabilitation of the older adult is done, rather than them thinking that they might be disabled for life.
Are there a lot of lifestyle related symptoms that are cropping up these days? Because I'm on my way to becoming a geriatric already. So I would like to know at what age we really start to need to start looking out for the red flags, and what is it that we really need to start noticing as, maybe indicators that we need to change our lifestyles now, maybe slow down, maybe speed up, maybe start becoming more active physically. And what are the physical and mental activities that you would recommend to people to not give up just because they're aging? And we do get tired more easily than we used to earlier once we hit our 50s. So what would you recommend to people of my age group, which is 50 plus, just pre-geriatric, I think?
Yeah, so I would say ultimately the real time you need to get really fit is actually in the 30s. To be very frank, that is the time to really start off. A lot of nobody ages in a day. Aging is a process, and you want to age well. So aging gracefully or healthy aging or successful aging is the term which is important, and
Right.
not anti-aging in general. Because see, reversing everything, there's a lot of research going on, maybe we might be even getting to it. But one is very important, is to try to preserve what you're aging. So, and as far as you're getting a real serious health checkups is concerned, mostly the good part is a lot of younger people are also involved in a lot of corporates and a lot of maybe professional organizations in which an yearly health checkup is done anyways. But if you're not, and as you get older, before retirement, of course, most people do get retired at 60, so you don't start thinking about 60 at 60, you start thinking much, much more earlier. I think 50s is a good time to actually start doing a very serious health checkup, at least an yearly health checkup, which helps you in screening everything. Remember, prevention is always better than cure. So whether it's screening for diabetes, whether it's screening for hypertension, get your panel of tests which are needed, get an echo done maybe for the heart, and depending upon whether if you had family history or you already have a history. I mean, it's not that only 50, after 50 you will get your diseases. If you already have a heart disease, then you need to make sure that you are doing things pertaining to that. Then diet, lifestyle, exercise. I think these three things matter a lot, because the good diet, a diet varies for every older adult. Let me be very frank. If you're 50 and another person who is 60, your diet will vary not because of age, because it's an individual is different. But 250-year-olds also can be very different. I mean, the population itself is so heterogeneous. So that's why it's very important that a specific diet plan is given to a specific person. Then exercise. I think exercise is, to be very frank, one of the most important things which takes care of most diseases and indirectly taking care of any disability which might ensure because of the diseases. Now, exercise is also important in trying to make you aware that how much your body can do and how much you should do. So, for example, if you actually, ideally, you should be at least walking for 150 minutes a week. So, which is around 30 minutes if you see 5 days and you give a break, or you can divide it. But you should know that the intensity of exercise matters. You can't just rush the first day, then you get tired and you might realize that you don't want to do it the next day. And it happens a lot in older adults. It's never too late to start exercising, because ultimately exercise is very important for all the diseases, whether it's diabetes, whether it's heart disease, whether it's prevention of stroke, whether it's actually controlling your hypertension. So you should know the intensity. So for example, I tell most older adults, try to start slowly. Try to give yourself time to actually get a bit accustomed, maybe 15 minutes, 20 minutes, and try to increase it steadily over the week. Another important thing that older adults never do, or sometimes mostly avoid, is doing a warm up. You always have to warm up doing before doing any kind of exercise, because ultimately you need to loosen your muscles a bit, because they have been stiff for a while if you're obviously starting exercising suddenly. Then another important thing that matters is pertaining to your conditions. You might need balance exercises as well, balance and strengthening exercises. So that obviously helps you in overcoming any disability you might already have. Then footwear is important. I think sometimes you might already be disabled to a certain extent. For example, people have rheumatoid arthritis. Deformities can set in. Rheumatoid arthritis is not necessarily a disease of the old. It can come in middle age as well, and young also. So basically, if you have deformities, you need to modify your footwear according to that, because ultimately, or else it will lead to a fall, and then that will obviously cause further disability. Then another important thing, as far as your mental aspect is concerned, is stress. I think stress is very, very important in everyday life, whether it's a younger person or an older person. But as you get older, even more so, because there are a lot of sources of stress which might creep in. One is, of course, sometimes financial instability can be there, not because you haven't saved enough, but because when you get a health problem, and then you have to break those savings to actually an admission anywhere. I'm not even saying in a particular hospital, depending on the condition, can be really sort of increase the financial burden, and then leading to stress. Another thing is emotional stress. I think a lot of older adults might or might not be living with their children, not for any reason. I'm not going into the reasons in particular. They might be wanting to be independent, but when a disease comes in and hospitalization happens, dependency naturally occurs, and that older adult couple might not be necessarily able to take care of it themselves. So sometimes partial disability also sets in. So to overcome that, of course, you need help. That's why have a good set of friends, have a good set of relations, because all the social network matters a lot, especially not only in time of need, but in, to be very frank, to maintain sanity. I mean, it is not even I mean the apt time to talk about it, because we have been in a bit of a pandemic since the last 18 months, and it has obviously caused a lot of mental clutter also in all age groups, older adults even more so, fit older adults even more so, because they have not been allowed to go out, and they are like, we are okay, so why we are not going out. But there's always a silver lining. So people have embraced technology. More and more older adults have gone online. More and more older adults have connected to new and new people who they wouldn't have even thought in Jan 2020 they could actually be even using a mobile phone. I mean, I know personally a lot of older adults who never used to even want to have a maybe a great phone. They said that phone is used for just calling and messaging, but now they are the ones who are taking initiative and actually coming on Zoom meetings. So I think with every sort of downer we actually get an opportunity, and I think the pandemic played a very important role in us thinking to actually how we can sort of improve the older adults health. Another way of course is to be connected to your doctor. I think that is very important, whether it's in the pandemic or not in the pandemic. As I said, teleconsultation has really come up. You should be in touch. You shouldn't think that the doctor is not accessible, because there have been cases where people have not visited doctors for 18 months, 24 months, not because they don't want to, because of these circumstances, and things have gone bad because instead of focusing on their diseases they started focusing only on the pandemic. So I would say be in touch with your doctors, whether it's with your phone, whether it's with WhatsApp, whether it's with video calling or through teleconsultation, because I think that matters a lot as far as keeping a check on your health is there. Then I would say older adults also are divided into three groups: old, young, old, and middle old. Young old, middle old, and old old. So young old is 60 to 69, middle old is 70 to 79, and more than 80 is supposed to be old old. So when people are already in the 50s, what you should also do is look at an opportunity to help people who might need that help. By that I mean fit elderly or fit older adults can help those who are unfit. By that, it doesn't mean that a 60-year-old will take care of an 80-year-old. No, an 80-year-old fit person can also take care of a 65-year-old who actually has a lot of diseases, and this will help in overcoming that disability. It helps in creating new bonds. It helps in creating new friends. So ultimately I feel if you want of overall physical and mental well-being, you need to start working on one thing, that is health. And I think 50s is a good time to start. After all, health is defined as a state of physical, mental, and social well-being. So you take care of all the three, then only you will go towards what we want to be as a healthy aging.
Right. Thank you. It was an elaborate and very enlightening answer. Thank you for actually taking the pains to explain it so well. Um, the next question, of course, is since geriatric patients tend to be susceptible to certain conditions, is the diagnosis of diseases tougher due to the breadth and overlap of symptoms? Sometimes, is there a confusion because of the symptoms? How does this influence how disabilities are managed then?
Yeah. So as far as the older adults are concerned and their problems, most importantly I think they are not complex. The diseases and their conditions can be. We need to understand that we are dealing with an aging body along with disease, so that complicates things a bit. And as an elder care specialist and as a geriatrician, what I have learned over the years is you need to break down those problems. So once you create a problem list through an assessment which is known as comprehensive geriatric assessment, you are able to sort of get different factors. So for example, if an older adult has pneumonia, it's an emergency for me, so I will want to treat that pneumonia first. But that doesn't mean that if I am taking care of the cognition, I want to take care of their anxiety and depression if they have it. If they have at a risk of fall, I would want to obviously make sure that that risk decreases. If they have bed sores, I would want to cure that as well. So the point is to have multiple problems, which they will have, but try to individualize every problem and treat them, rather than only look at an older adult as a very person who has multiple problems, so it becomes difficult to handle. So when you break it down, it always becomes very easy to treat older adults. However, what becomes complex is the diseases and them calling disability. For example, if somebody has Parkinson's with diabetes, Parkinson's already will lead to a bit of, you can say, disability because of difficulty in walking, stooping, slowness. Maybe the diabetes is already causing some neurological deficits like lack of feeling in the feet. then walking becomes difficult. I mean, a lot of patients have been seen where ulcers have been just discovered because they didn't feel it. So when you see it, you see the ulcer and you're like shocked that when did it happen, because the older adults themselves will never be able to sort of tell that. So what we need to sort of do is, the complex interplay of diseases can always be difficult to tackle as far as disability is concerned. But when we try to look at reversible causes, then we are able to treat them better. So, for example, if somebody has hearing loss, but we discover there is just wax, you remove the wax, the hearing loss is back. So, one disability treated. If somebody has side effects because of drugs, you tend to stop that particular drug, so the side effect obviously will go in some time, and that is treated. So we need to, so that's why I said the factors that is causing the disability is very important rather than the disease per se, because sometimes the disease can be very stable, but some instigating factor is the one which worsens it. For example, if somebody has been very controlled diabetes, I mean, everything is fine, hypertension is controlled, heart is fine, but they get a lung infection, then everything starts getting affected. The heart might go into failure, the lungs might actually be an issue, the diabetes might become uncontrolled. So when we treat that, everything will sort of uh, get regularized. So I think it's very important that we break down the the individual problems. Another thing is, I would say, there is always this tendency of thinking that if the person is older, maybe surgery is not an option. It's a general notion, more, and not the surgeon's notion, of course, but the general public might think so. So it's important for us to know, for older adults to know that no, that's not the case. Cataract is one of the most important correctable things. With cataract, you can have poor vision over the years. If you remove it, insert the lens, you actually will have better vision, and vision itself improves that particular disability. So rather than having any sort of back step that why I should do the surgery, you should be even interested in trying to take initiative in doing it. Another important thing is joints. I think, see, of course, if you have a hip fracture, there is no other option but you need to get operated. But sometimes the delay usually happens with knee, when there is knee osteoarthritis and it's very severe. But everything has been done, medications have been given, exercises have been prescribed, but the older adult does not want to go undergo the surgery. The older adult, if obviously not having a lot of medical issues, can undergo the surgery, and with physiotherapy can improve. So it's between just sitting in pain, thinking, oh my God, I am disabled, as compared to an effort for the surgery. Yes, every surgery has its risks, but post surgery, doing a good rehabilitation and you actually trying to walk. So that is the sort of difference. And we should try to convince an older adult in that way, rather than just telling them that, oh, it's a surgery, it's a very simple surgery, it should be done. So a lot of times an older adult will be not convinced completely. So it's important that as diseases progress, we are obviously able to maintain how badly they are progressing. And that happens through continuous follow up, that happens to regular checkups, because ultimately, not everything can be just monitored without maybe getting in touch with your doctor. What's important as a caregiver is that you need to know the red flags.
Right.
Suddenly if the I mean, if the sensations in the feet is going, if there is any imbalance, it could be because of diabetes. If the person is worsening as far as stiffness is concerned, maybe the Parkinson's is worsened. Then things like there has been chest pain continuously with no reason, so the heart could be involved. So certain red flags are there. Unfortunately, not everything which is comes in the textbook is usually a presentation in the older adult. So you need to be an older adult might just present with altered behavior, and
Right.
that could be even a heart attack. So it's very important that when you think something is not wrong, please try to get in touch with I mean, healthcare professional. Depression can easily be missed by a caregiver. Why? I am feeling weak. Next day again, I'm not okay. I feel lack of energy. Oh no, it must be a part of aging. Why don't you just eat? And this continues a week, and then the person maybe even stops talking. So, and of course, mental health somehow is always given a lower priority, not because they want it to be a low priority. Imagine a heart attack. You get a very nice glorified chest pain in which it seems that everything is going to end. But in a mental health problem, when a person is feeling low, if there is no recognition from a person outside that particular internal milieu, it becomes very difficult for the older adult to themselves say that I am actually feeling low.
Right.
So what do I do about it? So subtle signs, very important. Of course, if you're not able to get it, we are there to help you out. So try to get yourself more and more educated with health personals and not only Google.
Thank you for saying this, because we spoke to a developmental pediatrician. And, I was just Googling early intervention, which is something that we work in a lot. And every link was about children. And I said, how can this be? Because early intervention means the moment you have detected a disability or diagnosed one, you have to intervene. It doesn't matter what age group the person belongs to. So I think even when it comes to younger adults as well as older adults, seniors, prevention, detection, and early intervention is an ongoing thing throughout our lives. I think we have to make sure that we're looking for the red flags. Um, One question that I need to ask, because we work a lot among people who are from the underprivileged and underserved backgrounds, would you say that there is a variance in diagnosis, treatment, and care of geriatric patients from different socioeconomic backgrounds? Of course, the answer is yes, but if you could please elaborate on what are the differences really?
Yeah, I think to be very frank, aging treats almost everybody pretty similarly as far as socioeconomic status is concerned, because there is no socioeconomic difference in somebody getting a disease.
Right,
Yes, there is a socioeconomic difference maybe in somebody actually getting the treatment, because Alzheimer's can also, a person who's the richest person on earth can get Alzheimer's, but a person who's very poor can get Alzheimer's. What is the access of care? Is the person with a better financial background might get it easier as compared to a person who might not be able to get it. I think the important part here is screening. Having a lot of screening camps, even in, for example, villages, and even smaller socioeconomic state strata, is lower socioeconomic strata, is very important. Why I'm saying this is education is directly proportional to going for treatment. A
right,
person who might not be educated about the disease, I am saying, I'm not talking about degrees or literacy here. A person who might not be able to be educated about the disease at all, so without no sensitization, how do you expect a relative in a lower socioeconomic status to actually detect or think that something is wrong? So screening is important, and screening can be given to them by a very simple sort of screeners, and a lot of people do that as well, trying to go to their homes and do it. Now the problem is, due to lack of education about what's happening, there is always a tendency for people with low socioeconomic status to think that something is fishy. Why are they trying to sort of take this? Is it going to help us in the long run? Is it only for some information that they want? Now what's important is that we not only take information and detect it, but we try to treat it. And I think a lot of government places, organizations, that's why NGOs also come in. A lot of NGOs are doing very good work. HelpAge is one of them who does a very good work, especially people with lower socioeconomic status, in which at least getting them with, you can say, eye surgeries. I think eye surgeries is very important to actually get a disability treated, especially in lower socioeconomic status. And there is also organizations like, you can say, I mean, I am with an organization known as Graceful Living, where we obviously take care of older adults. So a part of it is an NGO which is known as Tulsi Trust. So they also do a lot of things, especially with eye surgeries. Now you see, when you do eye surgeries, you are taking care a lot of disability in a huge number of population, and there are doctors who are willing to do it. All you need to do is obviously give them that particular, I mean, facility, and
right.
it's the surgery is not very complicated, and people are getting vision. So there is something known as Mission for Vision, which Tulsi Trust does. Then another important thing I think is in general, try to not think that everybody will understand the same way. For example, if I am doing a video and and this is basically given to maybe an educated set of people who maybe
Right.
know already about the disease, they might already have questions before I even talk, because they have googled up everything, or maybe they have undergone it. Let me be very frank, caregiver of an Alzheimer's patient knows a lot of the disease because they have tried to tackle the disease. So we need to modify as even healthcare professional and how we are trying to approach them. A layman is going to be very different. You need to make sure that medium is different. Maybe a paper medium might be much easier, or a live talk might be much easier than maybe a video. So these campaigns which are done, for example, if I have to just, with no obvious gain for me, if I have to quote one of the campaigns of the National Tobacco Program, it had a cricketer Rahul Dravid. So don't get run out is what it said. By smoking, your life will get run out. So they were able to sort of relate that, okay, this is a common thing. So things like that. So you cannot put too much of technical terms and just
Right.
confuse them, because what scares them more sometimes makes them not look at it at all. So we need to sort of maybe just make
Simplify.
sure that, yeah, define it properly, and make sure that the person who's not able to understand is able to understand, because the person who will be able to understand will be able to understand anyways. So I think different media should be used. I think that's one of them. Sensitization about every disease as far as older adults is concerned, disability is concerned, is very important. And the fact that not giving up, when disability sets in, people, a lot of people just feel that now it's the end of the road, so there it's not a correctable. So and sometimes for lower socioeconomic status, it just becomes between whether trying to help them or trying to get their home in order. So that sort of decision
Right.
becomes very, very difficult. So I think it's basically a private public partnership, and a lot of NGOs who should get together, and which they are. A lot of wonderful work is going on, and that's how we'll be able to detect, diagnose, and help them. There is no use telling that we can help them. We need to detect the problem, and then only we'll be able to help.
Yeah, absolutely. Do you see more cases of dementia, Alzheimer's, and Parkinson's now than you used to earlier? Is it because we have a larger aging population now?
I feel, of course, as far as cases of dementia was concerned, it was always in the increase. I would say cognitive impairment and not dementia, because not everything should be branded that it's a dreaded D word, if I have to say, because
Right.
once you label somebody dementia, then a lot of, for the initial shock, it's almost the end of the road for most people. Yes, with aging, of course, Parkinson's was already there, but we are seeing more and more cases, of course, of overall, because aging is already happening. And although people might say it's a young population of India, but there are a lot of fit elderly. So we are actually looking at a huge older adult population, which was very clearly seen in the vaccination drives as well,
Right.
that there is a huge population which needed to be vaccinated. So it's very, very important that as we go ahead, we recognize the problems of older adults. And overall, yes, my issue only is, if you don't look for certain things, then you might not be able to get it. So in older adults, it's very easily missed.
One last question, Doctor. Are there any changes you suggest to our current healthcare system that could yield better results in terms of care and long term management? What is your wish list? Because geriatric care is not an extremely old field. It's something that is more recent and very important. So, what would be your wish list?
I would say ultimately, most important is, on top of my wish list, is, of course, I think sensitization. People should know what geriatrics is, what elder care is, who is a geriatrician. I'm not saying it because I am one, because people need to be educated. If I talk about pediatricians, people will be like, oh, yeah, those are people who actually take care of
You
children
would be
and the younger.
surprised. No, no, you would be surprised because when we talk about developmental pediatrician, they do not know
No,
what
no,
that means.
no, they don't. So I'm not going into a specific specialization. That's why. And then, of course, but it is much, much better if you say sensitization as compared to knowing who a geriatrician is, because
Right.
most people get confused with geriatrics and genetics also. That has also happened personally. Department of Genetics and Department of Geriatrics. I mean, it's not because, maybe it's because of a spelling mistake. Another important thing is sensitization of not only the older adult, but the caregivers, and then
Absolutely.
also the younger generation. I think the younger generation need to be selfish. Why I'm saying selfish? You will get old one day. So know about aging, not because you have to care of the old or take care of the old, but you are going to age yourself. With medical care getting only better, most people will be able to see their old age. So that is something which is very important. And then try to, I think, as far as a policy wise is concerned, a lot of laws are pretty archaic as far as the older adults are concerned, and they need to be revised continuously. I wouldn't say that the government is not trying to do it. Yes, they are trying to do, but then with sort of, sometimes what happens with the period of time, it just becomes too much for the older adult to actually wait, because aging is a continuous process. Making policies and updating him should also be very much a continuous process. Then another thing is, we should focus on utilizing the most important resource we have, the aging population.
Right.
It is a plethora of experience, it is a plethora of knowledge, and they can never be considered, according to me, as a burden. According to me, they are the most important treasure in an aging population or in any population. Why? Because if given the right opportunity, which more and more people are, retirement might just go off sometime. People are talking about early retirement, so we are not even going to talk about people reaching 60 and then actually retiring. But there have been a lot of older adults who are doing very unique things, and I mean, people are taking online classes now, just sharing their own experiences. I mean, we have a support group meeting in which we have so many older people who actually share their experiences. Then there are a lot of, I would say, if you mix the young and the old, which is something known as intergenerational bonding, I think that is also something which I would encourage. Why? Because with the young comes all the spunk, all the technology, and all the ideas. With the old comes the experience, and all you get in the end is a very polished, very nice polished model. Because ultimately, if put in right quantity, then they would work very well together. Then another thing, as far as society wise, I would say, is it's not about the young and the old. It's about both taking two steps ahead and meeting in the between. Because that's how life goes on. Everybody is going to have a life cycle. So you can't always think that the younger person is going to think like the old, or the older person will be able to adjust with the young. But both should adjust, because that's how we will be able to get into a very, I mean, very successful sort of society in future as well. Then another important thing which I feel is, try to work on different areas of geriatric care. Geriatric care is not only about the hospital, and not only about maybe the home, but it is also about the community. So there have to be more facilities in the community, whether it's daycare centers, whether it's actually, I would say, I mean, creches are very much popular as far as younger, I mean, children are concerned. So similarly for older people, just come, maybe have their daycare centers, have their activity centers in which they do the activities, and then they go back to their own homes. Then more concentration is getting also in assisted living. I mean, there are a lot of
Yes,
assisted living
absolutely.
communities which are coming up down south, up north in Gurgaon, and a lot of them are there even coming up in Bombay as well.
Yeah.
Of course, there's one in Pune as well. Of course, Athashri, which is
I
quite
agree.
famous. So the thing is, assisted living, communities, long-term care, these are all different things, but they need to come up. An older adult should have the option of saying, no, I want to live with a group of people, not because I mean, people are not comfortable with me at home, or I don't, I mean, I am pushed into it, because I want to do it, because
It's a
ultimately
choice.
I want to, yeah, I want to actually have more friends. So, and more is actually happening. And I would say the biggest boon, which I repeatedly have said during the pandemic, is it gave us an opportunity to think how we can redefine elder care.
Correct.
And that has happened with a lot of startups coming up with unique things. Engineers, obviously, technology has come in, AI has come in. and a lot of doctors overall, the healthcare professionals, along with maybe professionals with every sector, have actually got on with better platforms to make sure that yes, we will be able to help the older people. Now if you see, at this moment, because of the pandemic and because of teleconsultation, I can look at a bedridden patient from home. Maybe earlier I could have only done it if I could visit them. So ultimately I would say, to deal with elder care, I know it's nascent, but ultimately we will get there. It will need resources yet. It will need more personals. We don't have a lot of geriatricians. We need more skilled people. We need more caregivers. So a lot of education of caregivers is involved. Not every caregiver of home, by that I mean relatives, will be able to manage everything. Ultimately they also need to be given respite. It's not easy managing an Alzheimer's patient 24 hours.
Right.
So we need more skilled professionals, and of course we need more people to sort of chip in through their skill sets to actually create a good force. So the force has to be multi-dimensional: healthcare professionals, caregivers, counselors. I mean, an overall multidisciplinary sort of, you can say, a
Okay.
team approach, which would obviously help in making. I would say the most important thing in older care is quality of life. You might not be able to change a lot of things, reverse a lot of things, but you can preserve, make sure you persevere, and ultimately make sure that they actually have successful aging. Death is a part of life which everybody knows, but the pathway to it, if it is kept the best, I think any older adult would be happy.
That is wonderful. I like the way you've rounded it all off. Thank you so much, Doctor. That was a wonderful chat, and nice of you to have spared your time on a weekday. Thank you for being here. Thank you so much, MCure, for being our sponsors. Thank you, Team Ekansh, for the back-end help. Thank you all, those who are watching. Thank you very much for having logged on and for spending time listening to us. I'm sure it was, you will all find this extremely enlightening and helpful. Thank you so much.
Yeah, thank you. Thanks a lot. Thanks for having me.